Thank you. Welcome.
I'm going to grab some notes real quick. Coordinate with Tim on that. Thanks for the EV, Tim. So here to talk for, I think, 45 minutes. Is that right? 20 minutes about back pain. And so, but why back pain? Why are we talking about back pain? So, I think just we know across our lives that we're all having some type of experience with spine pain or back pain of some sort. Thing is, it's the second most common medical problem in general, right behind upper respiratory tract infection. And a lot of times we think about back pain as maybe a one-off event, a couple of days a year, a couple of days, 2-3 times a year where your back goes out. Research more recently has demonstrated that these episodic back pain issues are better described as a chronic episodic issue. So there's an underlying movement problem that rears its head regularly with these episodic issues. Other people are really sidelined and negatively affected by a chronic, ongoing, nonstop back pain, which is the second most costly health disorder in the country, right behind diabetes. So chronic back pain is a major issue. It affects about 10% of the population. 90% of us will have these episodes of back pains periodically. And it can be really frustrating. So what I want to do is just take a couple minutes to bring some high quality information to you guys so you can share it effectively with people that you know who may be affected by back pain. So are we good to go? All right. So Mary, thanks so much for the introduction. You gave us a little bit of information about who I am and what we do. Thing is, I didn't start this. My father, Dr. Richard Cole, started this. Actually, my grandfather did. He started this whole thing. And so now we're blessed to have 6 chiropractors together, recently joined by Dr. Daniel Smith here is with me to help people out. Let's see, we're falling out. You'll advance to that next slide here. So just real quick, how we get started with this whole thing in the first place. So 40 years of care to the Memphis area. My father was assisting people with their spine pain and headaches and other joint-related issues using chiropractic manual treatment. And what he found was that he was helping a lot of people. But there are other people who might get better with something different too. And so he got some advanced training, 3 additional years, getting a diplomate in chiropractic neurology. And his vision was to grow the practice. And so he brought in some other excellent chiropractic doctors with various specialties and has really designed a place that is, you can come to it and figure out what the issue is, and then we'll help either in the office or get you to the right place. Because if you think about it, if you have a pain issue, back pain issue, say, a lot of people have to figure out what the issue is first before they go book an appointment. Do they need a surgeon? Then go to surgery. Do they need physical therapy? Then go to physical therapy. Do they need chiropractic? Then go to chiropractic. But where's the one place, the one place you can go to figure out what to be done, right? And so that was his vision. That's what he's built. And I'm certainly blessed to work in this excellent environment where we can help people out and get them in the right direction, either in the office or get the MRI, get the orthopedic surgeon referral, get the pain management, talk to their primary care physician, get the right medications, talk to the physical therapist, and really quarterback the entire plan for the individual. So let's just play a quick little game here. What causes, what's this whole deal about sciatica? People come in about sciatica all the time, right? And what we're going to be doing is taking a look at a couple of different pain conditions, but let's just look at some anatomy. So just think about it. Why is the sciatic nerve such a big issue, right? Well, think about this. If there is a compression on the sciatic nerve goes from your lower back, it coalesces like all these streets through Midtown, changes names, and becomes that main nerve that goes down to the foot and into the great toe. Now, if that nerve is compressed, the nerve doesn't work as well. So maybe it hurts, maybe it's numb, maybe the muscles that the nerve goes to start to become paralyzed. It's not working as it should. So we need to differentiate here. Think about the spine anatomy. You have a back problem, When that back problem is affecting the nerve negatively, then the nerve doesn't work correctly. Numbness, weakness, maybe just an angry nerve, which is completely miserable because it's causing that pain that goes down the leg, even though it's not a leg problem. So a lot of times in the office every day, we are finding the actual cause of the pain and figuring out, is this a structural issue or is this a movement related functional issue? So that next slide there. All right, so I introduced our team. We got our team. One more picture. Some smiling, happy faces there across the bottom, I believe. How do we specialize in back? There we are. Excellent. So this is our team of doctors. Dr. Luke, Dr. Richard Cole, my father, Dr. Vollmer, Dr. Poston, there's me, Dr. Brad Cole, and then Dr. Smith. So we have a team of chiropractors, also assisted by two massage therapists that do medical massage and manual therapy by prescription there in the office. So if it's a conservative issue, we want to evaluate that and then make a plan for you. Let's use the AV here. Here's the big question. Is your back pain triggered by specific activities? This is the one thing. If you can take on one thing, this is it right here. If your back pain is reproducible, it is reducible. And so some people will say, hey, I can't stand for more than 20 minutes. My back hurts. I will walk 2 blocks. I'll go for a hike. I go for a run. Some people I'm helping out after the 25th mile of a run, that's when their sacroiliac joint starts to hurt. Some people can't walk and get up out of the bed. And so if your back pain is reproducible, then we can make it reducible. It is reducible because then we have a rehabilitative strategy if it's movement related, right? Now, if you've got an infection in your bowel, if you have a broken back, if there's a mass that's growing that's very dangerous, those are very rare, very dangerous. Those types of pains are pretty gnawing and constant. It's hard to get comfortable, wakes you up at night. Those are the questions that we ask, and that's the start of a good analysis to rule out the dangerous things. But the vast majority of these cases, we rule out the dangerous things, and now we're not left with a dangerous, scary issue. We're left with a significant issue. But if it's reducible, if it's reproducible, it can be reducible. So just think about this. I'm not raising hands, all right? But think about this. If you or somebody that you know has a back pain, is there a certain situation where it pops up more frequently than others? All right. So what do we do with back pain? What's the worst thing that we can do with back pain? Just to do nothing. Right. Just to do nothing about it, right? You know, if it goes away in a day or two, fine. If you can work around it, stretch it out, and get back to your normal activity, awesome. But what I hear in the office so often when I'm talking to people who have had these pain episodes over years or constant pain over years, the common story is that they have retracted their capacity. All right. It hurts to lift weights, so I don't do that. I stopped 5 years ago. It hurts to run, so I now only walk, and now I can't walk as far because the pain comes back. And so they've taken your capacity, your strength, what you do every day that keeps you strong and healthy, that stretches us physically, and we've narrowed that down further and further and further. Right, like this balloon that's deflating. We've narrowed our capacity, and what we found is that over the course of years, we still have this back pain disorder, the spine pain disorder, that is movement related, but without a solution, we do less and less, conceding to the pain problem. So there's 3 main approaches to one's spine pain. Of course, we talked about ignoring it, and it's not intentional, it's not nefarious. There's a lot of fear that can be built around this back pain. You can be fearful of it. This makes sense. If it hurts to do something, then stop doing it, hold still. It makes sense for a little while. Alter it so we can suppress back pain. Some people come into the office and they've got a back pain, but I've never met anyone that has a back pain from an Advil deficiency, right? Right? And so A lot of times we think, okay, this Advil's good for a while, now meloxicam, and now I'm trying to suppress it. Suppressing pain's good, but that's a short-term solution. That's not a long-term solution, right? Otherwise, we'll contract that because of those adverse effects from medications if it's the only solution. Or we can modify that. We can modify it. We can figure out what the movement sensitivity is, go through a good examination, rule out scary things, and then understand the pain better, what makes it better, what makes it worse, and then strengthen our capacity around that. Just think about like a professional athlete. What would they do? They wouldn't quit. They would understand the pain, figure out what makes it better, or strengthen those areas, very specific, targeted, and make a plan. So those exercise sheets, you Google back pain exercises, there's thousands. There's thousands of exercises, right? I never prescribe thousands. The one, the two, maybe the three that's targeted for your specific issue. That's how we modify it. So pills and medications, they have their place, absolutely, out for coordination of care with their primary care with the pain management physician on a regular basis, but it's not the only solution. So the Tylenol is not very effective for back pain, certainly not long term. Same thing with ibuprofen, NSAID, meloxicam, naproxen, those types of things. And then the steroid medications, you only have so much steroid per year, so many injections per year. Why is that? Because it stops the healing process. When your healing process stops, the breakdown is the only thing that occurs, and so it can cause a problem, right? It stops your healing process. That's bad. You can't do that long term. So these are very short term and temporary solutions for a significant inflammatory problem. Then we're going to turn the page and get to the next thing. So to truly fix the back pain, you need a solution that treats the cause and not just puts that tape over the check engine light, right? If your car has that squeaky noise when you accelerate, you just turn the radio up. That works well. I got a truck that works well for that, but not for our bikes. So what causes this back pain and sciatica? We're going to run through a couple things just so we can put these into buckets. That's one of the first things to do in the office is look at the diagnosis and put this pain into a bucket. So herniated discs, you've heard about that. So it's a bulge or it's a compression of a nerve root from the discs. Sometimes the discs are painful when they herniate. A lot of times they aren't, but they can put a pressure on a nerve, and that can be very miserable. That causes what we talked about earlier. The nerve doesn't work well, so it can be hypersensitive. It can be numb. It can cause weakness. The stenosis and a degeneration that happens later on in life. The arthritis of the spine, it's like gray hair and wrinkles on the inside. It happens, right? But with that buildup, it can be a bit more sensitive to compression, right? When you're 12 years old, you can jump off a tree house, land, and run off and feel fine. A little bit of arthritis, and the joints are a touch more sensitive than that, right? Additionally, because of the growing, expanding arthritis, like you can oftentimes look at your hand, you see like an old injury, an old fracture of a joint, and the joint gets a bit bigger, or just the wear and tear causes joints to get bigger. Same thing in our spine. That increasing size of the joints takes up place where the nerves would be, and it puts a little pressure, a little irritation on the nerve. And then lastly, sacroiliac joint or lower back pelvic dysfunction is also really common. That can cause irritation, so worse with prolonged sitting or walking. Sacroiliac is pretty amazing. The pelvis, you can go from standing on 2 feet, stand on 1 foot, not fall over. They can't get a robot to do that and look like a human yet. It's really amazing, but it has to work correctly for it not to become painful. So herniated disc. This oftentimes it's a younger man's issue. It really is. So the issue there is that a lot of people will have disc degeneration. About 30% around the age of 40 will have disc issues. About 90% by the time you're 70 has irritation or inflammation and expansion or degeneration of the disc. A lot of that's normal and not causing an issue. Every now and then, that big, juicy, puffy disc in somebody under 40 years old can herniate or squirt out. It hits a nerve root, causes a host of problems there. The vast majority can be healed up with rehabilitation. We want to watch it closely You want to watch it closely because we don't want to have any permanent or long-lasting nerve damage from untreated nerve compression. So that needs to be followed very closely. I see these people almost daily when they're coming in acutely, because I need to know if, hey, we getting better, we good, or do we need to go straight to neurosurgery to have the neurosurgeon go in there and remove the offending compression on the disc. Got to get that figured out. Second, so the disc hits that nerve and it causes the nerve pain. Arthritis and stenosis of the spine, right? The arthritis and the stenosis, this happens a bit later on in life. That's when the nerves can become irritated, the joints become irritated because of the expanding arthritis. Now, this is beautiful because there are so many excellent rehabilitative strategies using manual treatment, using decompression to stretch those spinal joints out, using corrective exercises to stabilize and strengthen the area. That just doesn't get done in the right way. It has to be the right treatment, the right time, in the right series, at the right timing for the right problem. Otherwise, it's easy, right? So it has to happen correctly. But there's so much opportunity for individuals with this arthritic type of back. Now, this slide, it's a bit busy, but it's really important. So I'm going to take a quick little side note here. If you've seen a picture, X-ray of your back, you've seen an MRI of your back, and you notice that there's arthritis. Structurally, there's arthritis there. There's bone spurs. There's disc herniations and bulges, blah, blah, blah. It looks nasty. But, hey, maybe there's no surgical issue here. There's no emergent surgical problem because the nerves are okay. You don't need a surgeon, orthopedic neurosurgeon. Well, what are we left with? An arthritic back. That's now irrelevant. It really is irrelevant. So this movement dysfunction, the top circle, all right, you've got joints that are stuck, muscles that are out of balance, some tight, some weak, these postural stresses, and then poor blood supply because of the compression, and then maybe some nutritional issues, Juice Plus, that are in play. That causes more arthritis, and it causes these structural changes, right? But it also causes pain and symptoms that causes our behavior to change. If it hurts, we do things differently, stand differently, move differently. Because of that, we're going to sector those two out. They're no longer related because we can address the pain, address the movement issue. The x-rays look the same. The x-rays aren't the problem. These statistics here, 37% of 20-year-olds and 96% of 80-year-olds are going to have some type of wear and tear arthritis or gray hair and wrinkles on the inside. So we got to take that out of our mind as being the pathology. The MRI, the x-ray, that's not what hurts. I'm going to fast forward a little bit here, past a couple of these other explanations of back pain with the sacroiliac and the lumbar stenosis. I'm going to fast forward through that in the essence of time to go to this some really important part here about how we treat the back pain with sciatica, this proven approach. We talked a minute ago about how when someone has back pain, you or loved one, you have to figure out what the issue is and what treatment you get. So at our office, our team, we can look at your situation, talk with you, understand what your goals are, and then make a plan. The plan could be rehabilitation, non-drug, non-surgical in the office. It could be involving medication, anesthesiology, surgery outside the office as a component to that plan. But we can figure that out together. In the office, we utilize hands-on, chiropractic, manual treatment, massage, manual therapy, also manual traction of the spine, frequently at the lower back, to unload it and decompress the areas. These specific targeted, not thousands, not tear off piece of paper, do these things and see how it goes, but rather the custom prescription exercises to strengthen things up. And then laser therapy, there's your asterisk there, because you can do laser therapy, nutrition, heat supplementation, yoga, breath training, all of those factors that will make you less inflamed and less inflammatory, be a better healer for less pain and better back healing. All of that together. So there's no one cure, Sorry, there's no one treatment that really addresses these back pain issues. But if you've got a quarterback, you got somebody to advise about what combination of therapies is most effective, then that's really the solution for back pain. So take the first step towards pain relief. With this type of a group, you know somebody who might need some help. And this is what we're here for. So Cold Pain Therapy Group, Dr. Brad Cole, Dr. Daniel Smith. You can just look us up, easy to find online, easy to find within this referral network, but we'd be happy to sit down and chat and talk about what types of issues are there and what your goals are. That's our goal, is to meet your goals. So thanks, Mary Lou. Thank you so much. I appreciate your time and attention. And if there's any time for questions or questions after the fact, that's why I said that we're here for you. Okay. So thank you so much. I appreciate your help.